Hey everybody, Dr. Rob here. I've got a special guest, James. He's actually a patient who's kind enough to let me work on him in front of everybody out there. James is post-concussion. He's been seeing a lot of really good practitioners. He's down from Toronto. He is a hockey fan, right? So we have some great conversations, basketball, hockey, and all that. And he was nice enough, again, who's had a few year history of concussion, to allow me to do what we call a UpRegulation to try and help him get over the concussion. He's come down here for some advanced laser and nutrition protocols to see if we can get him over the hump. He is wearing his glasses. You don't have to wear the glasses when I use the Erconia light. We've got lights on because we're on Facebook Live, which are good lights, but we have, unfortunately, above us some LED, which the lights do bother him a little bit. So we're dimming those out. He doesn't have to do it for the laser. You all right? You ready to go?
Absolutely.
Okay, he's ready for what we call day 2. We want him on day 1. Day 1 would have been interesting. So here we go. So not to be tried at home, but for me, the Erconia laser has been great. It has FDA clearances. We have 14 FDA clearances. What we call UpRegulation is trying to get the muscle stronger. So I'll probably have to turn my back. Maybe I'll go to the side over here. I'll keep working off the side so you can see. So I'm going to be using 2 Erconia lasers. We have the Accelerate. The Accelerate is a red light, 635, great for parasympathetic responses, great for muscle healing, 635 nanometer, very low level laser, non-thermal. I do not have to touch the skin. It's always better to get near the skin. It's a non-thermal laser, real big takeaway. Number 2, we have the EVRL, Erconia Violet Red Light Laser, and the way I use it is it's got a red laser which has 635. It also has a violet light laser which is 405, antibacterial, antifungal, and antibacterial, antiviral, and antifungal. So it covers a lot of different things, and you'll see what I'd like to refer to as my famous patented vagus nerve upregulation stimulation with James. So here we go. We're going to do a simple little muscle test. We're going to check his upper body. So here's a little muscle test for the upper body. And yesterday, I'm going to show you, just let me have it. He went like that. So we worked on him, and now he's able to respond. Press against me. I can overpower him, and he's getting frustrated because you can hear him grunt. However, yesterday it was nothing. So he's better than yesterday, but let me make him stronger for you in front of everybody. So I'm going to turn the light on, and I'm going to take the Accelerate, and I'm going to laser his shoulder area right in here. So now put your thumb up, press up, and as you see, I'm going to press. There's a big difference.
That's so cool.
That's so cool. So now I'm going to go in what we call his scalenes. I'm going to turn, you okay?
Yep.
I'm going to turn you this way and get in on his scalenes. Now his scalenes are 2 muscle, there's 3, but the anticus and medius allow all the nerves to come through. So when I laser his scalenes and the nerves come through, I should improve an action potential. Rockkind has shown that using a 635 nanometer laser helps get more what we call action potential in neural transmission, and that should be evidenced by press up and go. So now you see a gentleman get really strong. Again, how long have you had the concussion?
2.5 years.
2.5 years. So right now I would say, wow, he got stronger. He's actually feeling a little bit better, all that kind of stuff. However, I want to test him. So I'm going to take the violet light. So docs who are watching see that I use the violet light in a diagnostic manner. So I go to my acne setting, violet light comes on, and I'm going to do the violet light right in the area. Yes, it goes through. It's a scatter. It goes through the shirt. About 40 to 45 billion photons are released, and the scatter can get up to about 90%. So a good example of that scatter is like taking sand and throwing it through a fence, but it's an open fence. So some get stopped, but enough goes through. So we just hit him with the violet light, and now press up, and he just was weaker than he was before. Let's do that again. Do that again. Let's see if I can do it with 2. Yeah, so that's an issue, and it really was a little, I'm speaking for you now, and I apologize. It was a little disconcerting for you to see that. So what's happening is I'm putting a sympathetic response into the area, even though his body is feeling better, and he took everything from the red light. He's still not ready. He can't take any charge, any perturbation, anything more than just a little stimuli. So now I'm going to go back to my handy dandy setting, and I'm going to use both the violet and the red laser, and I'm going to reset his autonomic nervous system with this. And we're going to go in here and just do that. I'm not going to go to his nerves. I don't use any violet light on the brachial plexus. I only use it on the parasympathetic vagus nerve, which I'll show you in a bit. And press up. And let me take that off. And press up. And press up. Now you tell me, how does that feel?
Way stronger than the last one.
Terrific. So with that being said, let me take my EVRL. If anybody's interested, buzz me. Can you see it? You have to move to catch up with me. And let's see the other side. I should have muscle tested him to begin with because there's a little bit of a crossover, but press up. And we did it before. I tested him before to see where he was. So here we go. You can relax. Press up and go.
Way stronger.
Yeah, dude, you're getting strong. So what I need you to do, I'm going to shut this off, is lie on your back. And I'm going to test the psoas. So normally we do 5 to 8 different muscle tests to upregulate. But in the interest of time, I'm just going to pick a few to let you guys know, get a feel. So if any docs are interested, please let me know. Reach out to me. I am going to be in Boston teaching a seminar this weekend. Any patients, feel free to call, DM me, IM me, anything of that nature. Let me know. We got some docs coming in to walk around the office right here. Do we have anybody screaming out at us, saying anything, or everybody's just watching? I thought James Shanks, who I have better hair than, would be reaching out, but that's okay.
Isaac Keegan gave you.
Hey Isaac, how are you? Hope to see you soon. Press up. So I'm testing the psoas muscle, and he's not doing too well. Hold on tight. Hold on tight. No falling on Facebook. So I'm again going to take the EVRL, and I'm going to take the EVRL right in his abdomen area and race it over his psoas. His psoas runs from T12 to L5. It makes a turn, hits the iliacus, becomes the iliopsoas. It touches the lumbar, the sacrum, the pelvis, and an extremity. And press up. And he's much better. You feeling a little better there, Chief?
Yeah.
All right, I'm going to come over here. I just got my mic a little caught. So I'm going to unleash the mic over here. We didn't take that into account. And press up. All righty. So let's upregulate his psoas a little bit. If you guys have any questions on this, I found laser therapy to be great. I've done 19 years as a chiropractor. The first 10 really was a lot of manual, hands-on, only manual, hands-on. I added a lot of rehab and laser since then. Still do active release. Big shout out to my friends at Factor. Do Factor on virtually every patient. Do a lot of rehab through Performance Health. If you can just take a quick look and see what we've got hanging. We've got a wall unit. We've got all these different things. So we have a full rehab. It's not just what you call just an adjustment chiropractic clinic. We do full rehab and things of that nature. We have vibration therapy over there. Hi, Vicky. Press up. And you're seeing a big change.
Way better.
Way better. So he's real happy. Could you sit up now?
Absolutely.
And face. So what we found a lot of response from yesterday's treatment. Remember, yesterday everything was blowing really weak. Press against me. So he was much stronger using his head. He, had a little brain fog from yesterday's treatment. And the reason he had some brain fog was twofold. Number one, I always tell everybody, you ever try and clean your pool? You can see the top, but when you wake the bottom up, where all the dirt was settled, it comes to the top and it's a little cloudy. So I think we woke some of the toxins up. Number two, I adjusted him and was a little aggressive with the adjustment. So that, again, took a lot of the toxins. He's doing really well today. We're going to make sure he can get to his hockey game at Madison Square Garden tonight. So press against me here, press against me here. And now I'm going to go back to my handy dandy EVRL. Go back. And we're ready to go. So the vagus nerve, I lecture on the vagus nerve. I do demos on the vagus nerve. Vagus nerve, really huge idea between the gut and the brain axis. It goes from medulla oblongata down through the transverse colon. It is your rest and digest nerve. It is your bidirectional communicator between your gut and your brain. It's a critical element. Your gut speaks to your brain within a millisecond. So I obviously want to clear this because he has brain fog. He's had some gastrointestinal faults. Since then, he's been doing a stellar job with a lot of his nutrition. So if I want to upregulate his vagus nerve, so everybody can see, come on you. Little violet light on my hand, just hard with the lights to really see. Medulla oblongata back up here, down through his transverse colon and back up. All we need to do is 30 seconds or less. Anybody else screaming out at me?
Efrain gave a thumbs up.
What's up, Efrain? Hola, ¿cómo está? Buenos días. Did I do it right, Steph?
Yes.
Outstanding.
Isaac asked, how are you doing?
Who?
Isaac Pagan.
I'm doing great, man. Life is great. If I can fix this guy and send him home with a big smile, it's going to make my week. Anybody else you have? Or everybody's quiet and just watching? Don't forget, we're going to do a live on Saturday or Sunday from Boston. And we're going to do a whole bunch of rehab with the FX 635. And there's his vagus nerve upregulation. Now, here's what I want to do. Thumb up, press up, and go. How does that feel compared to before?
Good.
Do you feel a little different when I use the vagus nerve for you?
Yeah, it was almost a little shakier. The strength was there, but it was just seemed a little shakier on the.
I got press up. Now the shakiness went away.
Yeah.
So what happens is, and what I found that the laser will work really well is, I like people to contract. I love a point and shoot, meaning I just take it and point and shoot, but I like when they contract. I found when they contract that ATP will lock in. You get that muscle fibro contraction. It works really well. So line your back one more time as a double check. Any questions? Anybody asking any questions?
No, Bill Corrigan just says, hey, Doc.
Oh, that's way better. The fact that I can talk while you're pushing right now,
There you
as
go.
opposed to holding my breath like before, that's cool.
That's cool. He's feeling better. Said, hey, Bill, what's up? Bill was a classmate of mine, so he knew that I was the calmest kid in the class. He's probably doing a whole bunch of smiles and yeah, sure, and everything like that. Miss him. Too bad. I wish you could come up to Boston if you had some time this weekend. It's on me, and I will buy dinner. How does that sound? So everybody heard that, right? It's live. Do you have any other questions?
And then Vanessa just waves at you.
Hey, Donnie, how are you? I appreciate that. Nobody's questioning. Okay, so there were a couple of things that people typically ask me about the laser, and they ask, question number one is there any heat? And as I alluded to earlier, it's a non-thermal low-level laser, so the answer to that question is no. You never felt it, right? No. Number two, for practitioners, meaning he doesn't feel it. I think you said you felt some energy.
Sure.
A little bit. So he's a good energy guy. He was a skater, so there's a lot of balance. Most people won't feel anything. So that one, that's really great for the patient. They don't feel any sensations, so that's real positive as opposed to me grabbing him and pushing him around. But the downside for the doctor is you really have to explain what's going on. So we had a conversation about what I was trying to do. Number two, eyes. He doesn't have to wear those. He's wearing those just to block my regular lights in my room. That was bothering him. He's still a little light sensitive. And if you take a second, if you come over here, we use lights on our Facebook Live, so it bothers my eyes too. The other question they ask, FDA clearances, which I said earlier. There's 14 FDA clearances. Now, that might not mean anything to you. It is a lot. It's a cornucopia, but it's 14 out of 17. So really the cornea lasers that I use really have captivated the market in research. And I am doing some research here on some of the lasers. I also have done some blood markers with the lasers. Things are looking really good. Very excited to add it over the last 8-9 years to my armamentarium. You feeling all right?
Yeah.
Anybody pop any other questions before we get to the last one? Guys, if you have any interest, feel free to reach out to me. I'm always there for you. I really like you all to like, share, and comment on this. And Stephanie wants me to say, don't forget about a YouTube channel. We do a lot of YouTube demonstrations, and it is drrobertsilverman.com. So every Tuesday, 2 o'clock, we do a Facebook Live. This weekend on Saturday in the afternoon, we're going live. We're going to be doing rehab with the FX 635. So we have somebody in Boston, Sean. She said that she'll be happy to, Sean works for Coney. She does a great job as a marketing rep. She's going to help me do some of the rehab, and we have 1 or 2 doctors, and you're going to see us go through a whole lower back rehab protocol with the FX635, the only laser that we know of, the only laser in the US that has an FDA clearance for chronic lower back pain. So here it is. If you have chronic lower back pain, do me a favor, give me a call. I'll definitely give you some answers. James, thanks so much. You've been a great, I know you talked a lot, but I'm sorry. Next time I'll try and help you out and not talk as much. Steffi's smiling. It means time to leave. Everybody, Dr. Rob, always yours in health.